in terms of the problems that it's helped you to solve, or at least understand and manage better, are there perhaps one or two of those that stand out?
So we felt we needed to improve the way we manage the laboratory results that come in through a system called PathLinks. And we found that patients were phoning in for results, sometimes at the busiest time for the practice, which wasn't conducive. Quite often it wasn't clear what was meant to be said to the patient. And now, of course, with access to the NHS app, we were finding patients were concerned about results, and it often wasn't clear what the clinician had written. So we rationalized that and developed common scripts about what we write about messages. The idea was that we would enable patients to look at their results as far as possible within the NHS app. We also created a special protected space, a clinic space, where results that need actioning, for example, somebody who may have cancer or who may have had a particular request from a hospital for us to follow up, which is where the continuity of care is really important. We created a system where patients could book in and talk to somebody about their results if it was concerning. Generally would encourage them to see the doctor or nurse that initiated the test, but we also had a general results clinic slots where people could ring in, for example, to discuss if they wanted to go on statins. And we created this self-bookable booking links through AccuRx system. So that's made a big difference. And the difference it's made is that patients know that there'll be a proactive approach to results management. And secondly, it's taken the impact and demand on other aspects of the practice who are dealing with results that haven't perhaps been managed fully or cause worry to patients. So I would say that's one example of results management. Now that works for us. Every practice will have a different approach. Now, as part of this, and I'd really like to emphasize this, we embrace artificial intelligence to help us manage our results. So it wasn't just the previous system, but organized in clinics, but we actually use artificial intelligence. And we've got a provider who helps us manage our results with automatic assessments and filing, flagging up abnormal results. And that saved us hours of a doctor's time and improved the assessment of trends, for example, in laboratory results. So we learned that there was a problem with the results and how they're handled. The practice team came across that. We put in a solution and we embrace artificial intelligence, which we're able to do through the practice level support program. And there are a number of providers who assist practices in doing that.